Today I'll be talking about basic life support. Basic life support, as the name suggests, it is the basic steps which you can provide to a victim and help saving the life. So in this topic I'm going to cover, I'll tell you the introduction, basics and steps of basic life support, chest compression and airway, how to do breathing, how to use automated external defibrillator, how to remove a foreign body from adult and pediatric age group, and how to provide a cardiopulmonary resuscitation in COVID area. So according to the recent studies, a sudden cardiac arrest is becoming the leading cause of death. Once the heart ceases to function, a healthy human brain may survive without oxygen for up to 4 minutes without suffering any permanent damage. It is during this critical period of 4 minutes, if a cardiopulmonary resuscitation is provided, it gives oxygenated blood to the victim's brain and heart, which dramatically improves chances of survival. And properly instructed, anyone can perform a cardiopulmonary resuscitation. So what is cardiac arrest? Cardiac arrest is cessation of circulation of blood due to failure of heart to contract effectively. So sudden cessation of mechanical activity of heart with some or no electrical activity. It may be reversible by a rapid intervention, but it leads to death in its absence. The steps for basic life supports are circulation, airway, breathing and defibrillation. As we all know that science is ever evolving. A decade before, the steps included airway, breathing and circulation, but with the changing evidence, it has been proved that circulation is the most important part, so we lay more importance on circulation and then airway, breathing and defibrillation. And this pandemic has taught us many things. So if you have to do a cardiopulmonary resuscitation in COVID areas, then P comes first. P is protection. You got to protect yourself and then try and save life by basic life support. If there is a victim who has suddenly collapsed or you've been called for help, you need to go and check for the scene safety. So the first step is the safety of patient and the rescuer. Suppose you are on a beach side or at a place where there is fire, so you need to shift the patient from that place for your and the patient's or the victim's safety. Then we need to check for response by gently tapping and see. If the patient or the victim responds, allow the most comfortable position. But if there is no response, we need to shout for help because we might need our team to give basic life support step and shift to the higher center. And after shouting for help, you need to check for breathing. If the breathing is regular, then you need to put the victim in a recovery position. If there is no breathing or he is gasping, then we need to check for pulse. Checking of pulse is generally done for less than 10 seconds so as to save on time. The carotid artery is used in adult and a pediatric age group, whereas in infant we use a brachial artery. If the pulse is more than 60 beats per minute, the palpable pulse, then you need to give rescue breathing. Because there was no breathing, pulse was there, so only rescue breathing is required, which you need to give for 12 to 20 minutes, that is one breath every 3 to 5 seconds until spontaneous breathing returns. If there is no pulse or bradycardia, that means if the pulse is present but less than 60 per minute, then we need to proceed for chest compression. Chest compressions generally, we give a high quality CPR, a high quality cardiopulmonary resuscitation, which means the chest compression which you give should be, you need to push hard, you need at the depth of at least 1.5 to 2 inches, which is depicted here in this diagram. In adult and child, you need to press down at least 2 inches and in infant at least 1.5 inches. You need to push hard. The rate of the chest compression should be 100 to 120 per minute. You need to give time to recoil and minimize interruption. Heart is situated between the two bony surfaces, the rib cage and the spine. So it needs to be compressed between the two. Now landmark is the imaginary line joining two nipples just below that and just above the xiphisternum. If it is much below, there are chances that it's going to break the xiphisternum, and if it is above, that means you are not contracting the heart, it is a cosmetic chest compression. Now if you are the only sole rescuer, then in adult and child the chest compression ratio to breath is 30:2. That is, after 30 compressions you need to give 2 breaths. If there is a child and if you are 2 rescuers, then 15:2. Whereas in adult, whether single or 2 rescuers, the chest compression breath ratio remains same. In the child, the chest compression ratio to breath, it changes. This is the diagram to show where exactly you need to place your hands. These are the nipples, just an imaginary line just joining the 2 nipples and just above the xiphisternum. This small piece depicts the xiphisternum. You need to place one hand over another, kneel down beside the victim, sit properly, keep your elbows straight. In the infant, you can use either a 2-thumb technique or 2-finger technique depending upon the size of the chest of the infant. One thing which is required here is that you need not take off your hands from the area between the compressions. That would result into wastage of time and the continuity will be broken. So this is to depict that the heart lies between the 2 bone cage and need to press hard, push hard, and then allow the time to recoil, because this time is required for filling of the heart with the blood and which is ready for next compression. If the chest compressions are not performed well, that may puncture lungs, fracture ribs and sternum, and it may lacerate the liver. After circulation, we come to airway, the A part of it. Airway means the passage by which the air goes from our nostrils and mouths to the lungs. There are 2 ways to open the airway. Why you need to open the airway is, like when you are giving rescue breaths, the air should pass without any obstruction. So opening the airway is like a sniffing position. When you just take a breath to smell a flower, you gently extend your neck, which should not be hyperextended or it should not be flexed, because flexing and hyperextension both will lead to obstruction in the airway. So any victim who your airway needs to be maintained, we need to use a method head tilt and chin lift, which is performed when there is no spinal injury. You need to place one hand on the forehead and push it down, the other hand under the chin and take it upwards. This opens up the airway straight from the nostril till the lungs. If there is a spinal injury, then the method which is used is jaw thrust. But if you are not able to open the airway with the jaw thrust in case of spinal injury, then you may use head tilt chin lift, because anyway saving the victim is much more important than avoiding injuries. Best is to avoid injuries and give the breath. Now victim's airway is open. You need to pinch the victim's nose and create an airtight mouth to mouth seal and give 1 breath over 1 second by taking a regular breath. For infants, nose and mouth of victim should be covered with the rescuer's mouth. 8 to 10 breaths per minute if advanced airway is placed. If there is no chest rise, again do a head tilt and chin lift to give the second breath. While you are giving the breath, covering the mouth and pinching the nose, your eyes should focus on the chest of the patient. The gentle chest rise is an indication that your breath is delivered properly. So this is breathing. Now we come to The second part of breathing, wherein you can use adjuncts if you do not want to give a mouth-to-mouth resuscitation and you are in a hospital setting. You can use the mask which is used for bag and mask ventilation and give it through your mouth like this, or you may, if you are two rescuers, then you may actually use a bag and mask ventilation to give the breaths. After making sure that chest compressions are given and you have opened the airway, given to rescue breaths, then if there is still no response from the patient, or if there is availability of an automated external defibrillator, which is now available in all the shopping malls and also in the airports, you can use that, and that is really going to save somebody's life. Now, there are studies to show that early use of automated external defibrillator have improved outcome in cardiac arrest. You just need to follow automated external defibrillator prompts. Any person who has used it once, be a medical or a non-medic person, can use automated external defibrillator. Actually, BLS can be given by anyone who has been trained. You need not be a health personnel to be doing this. You just need to open it and follow the commands. There are two pads in the external defibrillator. One you need to put, and there is a marking on the pad with the picture of a human, wherein it shows where the pad is to be placed. So one has to be put on the right shoulder, the another one just below the heart. A heart lies like this in a slanting position. So one below the heart on the left side, one on the right shoulder, and then you need to stop your cardiac compression to assess for the AED, to assess the heart rate and the rhythm. So once the AED assesses the rhythm, it will identify whether the rhythm is shockable or not shockable, and it's going to prompt. So if it is a shockable rhythm, we all need to stay away from the victim, and the shock is delivered by pressing. These are the buttons which will prompt you that you need to press here to deliver a shock. Before the shock is delivered, no one should be touching the patient, and once you place the pads, the area should be free of the hair. So you can use these pads to remove the hair and then place another pad, because you need to deliver the electrical activity to the heart. If the patient is a child, you can use these pads. Either you can actually cut it into smaller pads, or you can place one pad in front and another pad at the back of the child and deliver the shock. The idea is heart should be lying between the two pads, either anteriorly and posteriorly, or up and the low down. Once the shock is delivered, you need to resume cardiopulmonary resuscitation immediately after the shock for at least 2 minutes before you check the pulse again. Now, having done the airway circulation, airway breathing and AED, if you find any child or an adult who has accidentally ingested something and which has got obstructed on the upper airway leading to choking, then how do you remove that foreign body? It is shown that if the patient is conscious and has ineffective cough and the foreign body is easily visible, then you just remove it. But if the foreign body is not visible, please do not do any blind sweeps, as this may worsen the obstruction. For an infant, as the position is shown, you need to give 5 back blows and chest thrusts. Check for the foreign body which each blow and thrust, and continue till the foreign body comes out, or the child or an adult, he gets unconscious. Because anyways, if you are not going to attempt to take the foreign body out, the child or an adult, they will go unconscious, and it might, they might lose life. So by helping them by these maneuvers, you are helping to take the foreign body out and saving a life. So if the patient has effective cough, encourage him to cough. Monitor for deterioration with ineffective cough. This is a position to show how you need to give the back blows by the palm of your hand, and by the other hand you need to place the victim with the head down into prone position with the support of your forearm and thigh. right? Keep the infant jaw open in neutral position and make sure not to press the soft tissue around the jaw or neck. So give 5 blows and check for the foreign body. For an older child, you can place the child on your 2 laps and then give the back blows. Larger children can be held in forward leaning position and the back blows can be given from side. To give the chest thrust, again you need to place the child on your forearm with the support of your thighs, and with the 2 fingers, the position where you need to give chest thrust is same as that of chest compressions, like the imaginary line between the nipples and between the xiphisternum, but the pressure here is downwards and forwards, so that it helps in taking out any foreign body which is held up in the trachea. So infant is laid with the head down along with the rescuer's thigh. Chest thrusts are given using the same landmark as chest compression, and these are sharper and given at the slower rate. So for older children and adults, Hemalic maneuver is used, wherein you just place them standing and make a fist just below the xiphisternum and between the umbilicus, and put another hand and give the and apply the pressure so that the foreign body comes out. So these are the positions wherein you can actually help removing the foreign body. In cases of obese people and pregnant women, you need to spare the abdomen and use it on the chest. This is a universal choking sign. So you need to position the hands and apply the force as given. Proper positioning is very important. Avoid the xiphisternum and place the hands to give the proper pressure. Now in COVID pandemic, you need to protect yourself also. So these are the steps wherein your protection comes first. So protect yourself before starting CPR, secure the patient airway, restrict your team, place the tracheal tube, attach to ventilator early, AD and use of defibrillator, CPR in prone position, check for hypomagnesemia, because all the COVID patients generally which they take medication that results into hypomagnesemia, and early use of vasoactive drugs. So this was all about basic life support and foreign body removal. Thank you very much.